Governor Michelle Lujan Grisham is giving a live press conference on the COVID-19 coronavirus outbreak here in New Mexico. Let's go live to Santa Fe.
To make sure that as many New Mexicans as possible get the support that they need to remain safe and save lives. So thank you, Santa Fe Opera. It's wonderful. And I'm going to remove it. I want everyone again to know that we are very serious about the public health orders and about our commitment and to lead by example on stay-at-home instructions and all of our public health restrictions that are really aimed at three things: slowing the rate of transmission, protecting individuals, saving lives, and making sure that we don't overwhelm our healthcare providers and our healthcare system. So we are all socially distanced. Everybody comes into this room wearing a mask. The limited folks who are here in the room with their cameras are all wearing face coverings, and we take everyone's temperature. We know that these practices will keep us from unwittingly shedding the virus or for contracting the virus, and we take that very seriously. And I want to thank you, New Mexico, for also taking it so incredibly seriously, because what are we going to do today? Well, last week I said that we would formally extend our order, our stay-at-home instructions, through May 15th. But I also indicated that we believe, and you'll hear some more from Dr. Scrace, who's our very own New Mexico Dr. Fauci, that we are bending the curve, that we're doing it right, and that we're analyzing the data and the scientific evidence in a meaningful way so that we can make decisions. Based on that bending the curve, we can, as a parallel effort, we're going to talk about those specifics today, that this public health crisis has also become an economic crisis. And there is great urgency to be able to address both, and we believe that we can safely and productively do that. So we're going to talk about the changes to the order where we're easing restrictions. And then we also want to make sure that we spend a little bit of time talking about what the next couple of weeks are going to look like as we get through the middle of May and what we can expect, right? Because we have to actually now work harder. This virus, as we've talked about, lives among us. It's an invisible enemy and threat. And as we look at economic measures and supporting businesses and workers and the state, we're going to have to work harder in order to support that efforts. It's one thing to stay at home and not have to wear a mask and not have to worry about gloves, and maybe you grow a lot of your own food or you have your food delivered. You live in an area where you can successfully do that. That's limited cleaning, so you're not really leaving the house. Maybe you're a retired couple, you don't have children at home, you're not trying to balance some of those issues with outdoor walks and minimal contact with neighbors, but being outside. Well, that's hard, but easy to manage. Now I'm asking you, as we talk about where we're headed, to potentially leave the house because there's other things that you might be able to do, but I want you wearing a face covering, and I want everybody in the workplace wearing a face covering, and I want signs and sanitation. And the reason I want you to do that, because if you don't, then sustaining this recovery phase will get very hard to do, nearly impossible. And in addition, it's really unfair to our economic partners who are trusting that we're going to give them good, safe practices and criteria so that they can open up again, and they're not part of a public health problem. They're helping us manage this virus successfully as we live with it for the next 9 months, because that would be the only option. If we don't do it this way, so when folks ask me why we don't just shut down everything until there's a vaccine, that's impossible to do for a number of reasons, not just economically. It's impossible. So we have to learn to do better and better and better as time goes on until there's a vaccine. And so this is what we're going to propose to do. A big thank you again to our Economic Recovery Council, who did a ton of work. We are meeting every couple of days. So kudos to the chairs, Christina Campos, who's the hospital administrator in Santa Rosa, and former representative and grocery store owner Brian Moore. Thank you very much. All right. Let's go to our first slide, which is a quick case update, because this is going to sound alarming, and it's alarming to me every day. We now have 3,411 total positive COVID-19 cases in the state of New Mexico. 198 are new today. Now that's down from our high of yesterday, 239. It is not an indication that cases are going to continue to go down. It's an indication that we've been alerting folks. We're not through that transmission phase where cases will continue to increase, and our testing capacities, as you will hear about again, also increase. So we're going to identify and find more cases. What do we also know? There are a lot of New Mexicans, a lot of people around the world who have COVID-19 who are asymptomatic. So the more we do, the more we're going to find out about, which means the more we manage the virus transmission, the more lives we save. And that is what we're aiming to do. So we have 172 hospitalizations. We have 44 on ventilators. For folks who haven't watched this before, again, we have to know how many hospital beds we have, how many ICU beds we have, what happens when we have capacity and when surge capacity and then peak. So we have to really pay attention to that to make sure that we don't run out of the kind of care that folks who are really sick or in critical condition are going to need. We have a total of 123 deaths, 11 new today. Again, that's the most painful thing for any governor to announce in the country. There isn't a single New Mexican who doesn't mourn these deaths. And as we're seeing more and more of our vulnerable populations being preyed upon by this invisible enemy and losing their battles and their lives. We mourn with those families. It is always devastating news, which is again why the only way we protect these vulnerable populations is by working as hard as we can together. I'm going to give this number, and we're going to talk a little bit more about tests in a minute. We're going to do a little bit different because I really want to get to what is different today. So we've got well over 67,000 tests. I think the number is 67,879, and we're continuing to build capacity. And you should expect that we'll do more of that. You should expect Secretary Kunkel to remind people that we're now doing what we call more surveillance testing. But we're seeing other industries step up, get access to valid test kits, and they're also beginning to do sampling, delivering those samples to us so that we can run them and let everyone know what's going on in New Mexico, and that's a very effective partnership. All right, so here's what to expect next. Let's go to the very first, let's do it. The reason I hedged for a minute is I'm talking about a Navajo Nation rapid response team. I want to announce this really quick because as we go through today's press conference, we're going to be talking about all things aren't the same. The state behaves, the virus behaves. Its ability to find hosts depends upon how far people have to travel for basic services. So we know this risk. We've been addressing this risk. But you've got few cases in some regions of the state, and you've got a number, right? So McKinley County and Gallup now has more cases than Albuquerque or Bernalillo County. So these are things that we know cause great risk, and I think we can do a better job. One of the problems in addressing issues and attacking this pandemic, particularly in a place like the Navajo Nation, are the following. One, it spans 3 states. So 3 different state systems, state priorities, state testing strategies, all different. 2, like all sovereign nations, the federal trust responsibilities never been met. That means they do not have sufficient access to health care and they're responsible, federal related services or resources. 3, incredibly rural, so rural that in fact, even in New Mexico, they have limited access to running water and electricity and basic, sheltering needs, which require a population to have to move and travel great distances in order to bring that back every single day to their families. All right, so this creates unique challenges, and there are too many systems. Indian Health Service, State of New Mexico, Department of Health, University of New Mexico. Indian Health Service, the Albuquerque area Indian Health Service, the Navajo area Indian Health Service, the Navajo Nation, the 2 other states and the federal government, and our other partners like FEMA. It creates the perfect opportunity for gaps. And we have a tendency in government to sort of work in our funded jurisdictional silos. And when we do that, in my opinion, we aren't doing enough to solve a problem. So I'm announcing today that if we're going to be thinking about easing restrictions, and we are, and we're going to announce that, we also have to pay attention to our crisis centers and the areas where it's more difficult to protect New Mexicans. So this is what this does. The Navajo Nation Rapid Response Team has Kevin Washburn, former Assistant Secretary for the National Indian Affairs, Brigadier General Miguel Aguilar, New Mexico National Guard, Dr. Michelle Suina, Cocha de Pueblo, and also works with the epidemiology team in Albuquerque, Dr. Kevin English, Albuquerque Area Southwest Tribal Epidemiology Center, Dr. Paul Roth, who is the lead UNM Health Sciences and Chancellor, Dr. Leonard Thomas, leads for New Mexico and probably a region, the Indian Health Service, Dr. Alex Eastman, who is a clear partner from the U.S. Homeland Security. He's here representing FEMA and is available to us to think through any number of new strategies that can really make a difference. Rosalind So with the Navajo Indian Health Service, and Dr. Sarah Lathrop with the Office of the Medical Investigator. You see that there are a ton of physicians and PhDs, scientists on this team, as well as folks who know how to move giant systems that can really create this rapid response. Our expectation as full partners is to think out of the box, to remove any of those government bureaucratic restrictions that have prevented us to acting on the recommendations and requests from the Navajo Nation, and to translate that productive effort to the other states, Utah and Arizona. And for all New Mexicans, you should expect that we will do the same thing for every sovereign nation and think about how we can have a Native American COVID-19 response team and strategy. Kind of a shout out to Representative Derek Lente, who sent us a letter earlier this week. We're on the same page, and I appreciate knowing that there are so many effective leaders in the state of New Mexico all pulling together to make a difference where we need to make a difference. It, in fact, will and does save lives. Okay. So we are announcing today that the current public health order is expiring today, right? But effective tomorrow, we have a new public health order, and I've alerted folks that it's extended through May 15th, and that the magic about that is it gives us full 2 weeks to see what's occurring, to make sure that we're bringing to you our modeling and the data, and that we can make the next set of decisions based on that scientific evidence. Because what's the goal? Everything we do has to keep New Mexicans safe. And so where are we? So what's different then if I'm keeping a public health order? What's different? Well, we're now in a preparation phase. So here's what's changing. So non-essential retailers can open up. They can do that by having curbside pickup and delivery service where permitted by their license. Well, what does that mean? Not every retailer, as an example, liquor stores, their license, their statutory oversight in the state doesn't allow that. There isn't anything I can do to change that statute. Most retailers don't have those restrictions, so now they're allowed to open their businesses and provide those services to New Mexicans. State parks, I'm clear, we're all clear. Self-isolation and isolating is very hard, and with this incredible, beautiful New Mexico weather, the fact that people can't take a day trip to a state park to just engage in any outdoor activity and the beauty of the state, we want to make sure that we're providing this. Now, I want to point out that camping and visitor centers are still closed. We will provide this in a separate press release, and will be on the website. Not every state park can open all at once, although they're allowed to effective tomorrow. We do have to staff up and make sure we do all the work to make them as safe as possible by doing the right kind of signage for social distancing and cleaning, and we will do that. Pet services. So we know that adoption and groomers and doggy, maybe there's kitty daycare too, and boarding, that's been a real stress on families and pets. We want to make sure that those services are now permitted to operate. Again, we're going to talk about the standards for that and how you can make those as safe as possible for the public. Veterinarians always could operate in an emergency service, and people might wonder why we didn't just open it up again. You want to manage the virus, coexist, but protect people. No unnecessary travel, trips, or businesses. That did include veterinarians. Starting tomorrow, veterinarians are permitted to operate. Golf courses. Now, I want to be really clear that where we had no state authority, there were some tribal golf courses that have been operating. I know that that's caused confusion and maybe even in your community some consternation. My job again is to do the best possible job in the state with the authority that I have to protect people and slow the spread of the virus. So this was an area we just didn't want people traveling to. The Economic Recovery Council and I've adopted and accepted that recommendation. Golf courses are allowed now to open statewide, but for golf only, no dine-in, food service, or retail. And I said statewide, we have a state plan, but if the state plan can't be met by the entire state, and you will hear that later in my remarks and in this press conference, we have a region of the state that is not at a transmission phase that meets any of the gating, the federal requirements or the state requirements to meet this new public health order. So I want to be clear about that. Gun stores can now operate by appointment only. And the reason for that is too many New Mexicans need to be able to finalize their gun purchases for background checks. We recognize that, and we think this meets the same non-essential retailers criteria. They can't do curbside, but they are permitted to do by appointment only. So that changes tomorrow. Next slide. All right, so what remains closed with this instruction? Well, we still want you to stay at home. I know that that sounds like we give that message too often, but I drove to the Capitol today. I mentioned that I often do deliveries in Albuquerque to my family on the doorstep, and I go see my mother via a window, right? A wave. I can see, everyone can see, there's national aggregate data that shows you where people are traveling. People are traveling. The virus needs you to travel to transmit. You catch it, you give it. We don't want you to do that. We're staying the instruction to remain in place, except for these essential services. All right. What else remains closed? Offices, workspaces, and retailers, except for the exceptions. If you can't do curbside or delivery, and it's not an appointment-only exception, they're still closed. Dine-in restaurants and bars, except for curbside delivery, are also still closed. I'll tell you what we believe based on the contact and the time you spend there, which Dr. Scrakes is going to talk about. We made these decisions not based on the business, but based on the safety of the public and the safety of the employees there. We'll show you how we did that using an evidence-based model. Here's what's still unsafe and closed. Indoor malls, gyms, salons, theaters, and casinos. Mass gatherings, still prohibited. And the 14-day quarantine order remains in place for all out-of-state airport arrivals. All right, next slide. So how do we then move to the next phase? All right, well, we're going to continue to use the modeling by the medical advisory team, so you're going to hear more about that. But we analyze the spread of the virus. Where is it? How quickly is it spreading? What are those rates and ratios? And that's how we'll keep making decisions. So can you help? You bet you can. The more you restrict, even with opening, and we do want to ease the relaxing of these restrictions, we hope is good for business. We hope it's good for individuals too. We have to marry these safe personal practices, or we'll see a spike that's not anticipated, and that's when you're not prepared. Emergency preparedness means knowing what's going to happen. we are going to see more cases. Even without relaxing restrictions, we're still in that phase where we're going to see increased cases. We want to keep them below a certain percentage. We see how they're transmitting, what that rate is, where it is. As long as that curve statewide still is flattened, then we think that we can make these decisions safely, which is why we are. We have to continue having adequate and stable testing, and that's measured by the Department of Health. Quite frankly, we have a lot of partners doing testing now, actual testing and running the tests. But the Department of Health is leading that effort. It's an incredible undertaking, and they will have to continue to do that. Effective contact tracing plans and resources, that's going to be measured also by the Department of Health, and they have a very specific division, population health experts, doctors and scientists. That's the epidemiology division. That division has to have, they will tell us that they believe that we can do sufficient contact tracing. And I know that that sounds easy. I have COVID-19. I was identified as positive. Here's the family members I was around. I'm not working. And I went to this grocery store. I didn't touch anyone. We're done. No. You have to really think about if anybody else in the household, if you went for a walk, if you were in a car with someone else, what grocery store, where in that area, how close did you get to it? We have to do all of that work. And while we're moving to that digitizing phase of this work, it is still a lot of personal contact. So it's incredibly time intensive. And for places in New Mexico without broadband and telephones, it is even more challenging for a rural, vulnerable minority population. So it's a huge undertaking, but we are well on our way. And the healthcare system capacity and personal protection equipment levels, that's also measured by the Department of Health and by the medical advisory team. I keep pointing to my two experts and leads. That will be analyzed all of the time. And if that doesn't stay stable, what does that mean? That the healthcare system can take it, that we have enough equipment and support, then we can't go to the next phase. So we'll have a phase 1, more relaxing, phase 2, more businesses, more economic recovery. Phase 3 means we're closing in on a vaccine and we feel like it's completely back to normal with this. Everyone on the globe has learned the lesson about a pandemic. They can strike again, likely will, and we just have to start thinking about our own behaviors that will allow us to be as prepared as possible and to have our behaviors dictate the kind of responses that save as many lives as possible. All right, I'm really proud of this work. I believe that based on the evidence, it's a safe relaxation, begins to ease those pressures. The Northwest region of the state is going to require a lot more of our attention. They both deserve that attention and will get it, including bearing all of the resources we can muster to do everything we can to adequately reduce the rate of transmission, save more lives, and get through both the surge and the peak in that particular part of the state. Okay, I think I've run through all of my slides about the new order effective tomorrow. All right, current order expires midnight today. And you should expect more announcements related to the preparation phase through the Economic Recovery Council, the Mayor's Council tied to the Chief of Staff, and business observations and input as we move through this process. I'm going to go to the Secretary of Health, who's going to give us an update on testing strategies and information, and then we're going to move to Dr. Scrace, who will go through some of the modeling slides, and then we're going to be right back to answering questions. I want to make sure that KOAT is with us. We started about 5 minutes late. They were having some technical difficulties. I'm getting a good positive thumbs up, so I think all is well. Let's go to Secretary Kunkel.
Thank you, Governor, and good afternoon, everyone. I want to reiterate that we have a strong testing foundation, both in our lab capacity as well as our test collection capacity. We have many partners, as the Governor said, and we continue to look for opportunities to increase that. As you know, we've moved on from testing just sick people to looking for different ways where we might find the virus. We are targeting special populations, as I talked about last week, particularly long-term care facilities, tribal communities, essential workers, child care workers, and some subgroups within them. We are well on our way to testing every one of our long-term care facilities. We have a strike team or a rapid response team that will go in as soon as there is one positive response. When we have multiple positives in a long-term care facility, we have a different strategy looking at infection control techniques and helping to isolate and separate the individuals in those homes. As for essential workers, I want to say that there are many, many essential workers in the state. I don't want to say that nobody isn't. We are particularly focusing, though, on healthcare workers, grocery store workers, and childcare. And the public health division in every region is going out, making those connections, and continuing to look at that community. As we move forward, we're working with the different communities or the different organizations and committees that the governor referred to see how testing can inform and protect our attempts to reopen. And I'm looking forward to developing those strategies more in the future. Thank you.
All right, Dr. Scrace?
Good afternoon, everybody. I will, excuse me, take off my mask. I have a little bit more detail, a little bit more data. Today, we've been almost overwhelmed, but not quite overwhelmed, with requests for more modeling information, more data, more projections. And I'm happy to report that, as we promised last week, our modeling team data now and the regular presentation is online. So you can reach that, and we'll be sending that out in the press release after today. You can see the assumptions as they currently stand in the model. You can see a lot of detailed information about regions of the state and what we're looking at in terms of cases. And in fact, almost all the slides, not all, but almost all the slides I'm going to show you today are coming from that presentation as well. So if I could have that first slide, please. Thank you very much. I wanted to just, again, thank the folks at Presbyterian who've really put a lot of time and effort into this modeling, including Jason Mitchell, their chief medical officer, and many, many people at both Los Alamos National Lab and Sandia that are looking at different parts of this as well and working with us. This is there's a lot of numbers on this table, but basically what it shows is the weekly projected number of cases. And I'm going to focus on the middle column with a box around it, because what we've been finding is these LANL predictions track very, very closely week to week with what we end up seeing in cases. So for example, we're sort of between April 26th and May 3rd, and our case numbers are between the two numbers you see there. We're at 3411. We're moving up quickly on the May 3rd number, actually. And so I want to make sure people understand that when we talked about the fact that we were bending the curve, that we did not mean that the cases are on their way down. What we meant was we're seeing a slowing in the number of new cases every day, and that varies week to week. And I'll show you a better graphical representation of that. We were talking with the mayors today. Got a question from one of the mayors that said, if cases are increasing, well, why are we even talking about opening things up when we want to keep everything closed? And the answer to that really is, it's clear to all of us who are spending all our time at home, and those of you who aren't working right now, that the current situation isn't something we can do for another year until a new vaccine comes out and we've all been vaccinated. So we have to learn how to reopen and keep our economy going, while at the same time doing that in a COVID positive world. We may see a little bit of downturn in cases during the summer. Other forms of coronavirus tend to do that, but that we would naturally expect that the virus will still be among us. There will still be lots of cases, maybe 100 or more cases every day during this whole period, and that we're just identifying those people and tracing them and the like. And so we have to learn how to live in a COVID positive world and take those steps. But we also have to do it slowly and carefully. If I could have the next slide, please. Just some additional data. You can see that age distribution is about the same. The bell-shaped curve is just a little higher, and you can also see that we're continuing to see very, very high case fatality rates in older populations in particular. That's something that's been seen all over the world, and in fact, we're seeing a lot of fatalities in nursing homes, which is also something that's being seen all over the world, but that we're working very, very hard to control. And Secretary Kunkel has just done an amazing job expanding testing week after week after week, and the resources we're sending now into nursing homes are teaching us about how to control these epidemics. The literature also suggests that once you have one case You test everybody, and all the residents, all the staff, and that's what's happening now as well. So we're doing that. Next slide, please. So I think some people will be mad at me. We've been talking about doubling time now for quite some time, and that's the top number. And you'll be happy to hear that today it's 6.1. So we went from a doubling time at the beginning of March of about 1.9 all the way up to 6.1, which is a really dramatic improvement in how it means we're slowing down the spread of the virus. But because we're learning how to open back up in a COVID positive world, we have another metric that we've been tracking that I wanted to introduce to you today. And it's called the rate of spread. The technical name for it is the effective rate of transmission. And for the 3 epidemiologists in the office, but who are listening, I mean, but for the rest of us, we can just call it the rate of spread. And it really, that number you can see actually started at about 2.5 at the very beginning. It's the number of people that the average person infects. So if I have COVID, I would have infected on Saturday, the 21st of March, about 2.5 people. Worldwide, that number is 2.5 to 3.5. Generally, we live in a less densely populated state, but we've seen on TV what happened in New York in close quarters. And so if you look at that orange line, it's gradually coming down, and we're actually down to 1.24 statewide. So just to repeat, that means that every person who is infected with COVID infects, on average, 1.24 people. And then those folks, of course, there's no such thing as 0.24 people, it's just an average. Those folks go on to infect others. As long as that number is greater than 1, the epidemic continues to spread. As long as people infect more than one person. When it goes below 1, then the epidemic begins to die out. But we're not really expecting the epidemic to be gone until everyone in New Mexico has been vaccinated, or hopefully, the alternative would be having COVID and having immunity, which I'll speak to in a minute. Our heat maps, again, on the left there, you have the cumulative number of cases. We saw in the last week that McKinley County passed Bernalillo County for the total number of cases, and cases are going up. Last week I told you that 71% of all the cases that prior week were from the northwest part of the state. This week, as of today, for the first 3 days of this week, that number is 77% of the cases. And then you can also see the right side map is just a color representation of the relative infection rate in different counties. And of course, we can see right now McKinley is the highest. If I could please have the next slide. I think this slide tells the story better than any other slide. And I want to thank our epidemiology department for producing this. It tells the story better than anything else of what's going on in the state and why the numbers don't all seem to line up. And so the green line is every county in the state except for the 3 northwest counties, San Juan, McKinley, and Cibola. So that green line is the number of new cases per day, and they did a moving average over a 7-day period. So you can, if you have really good vision, you can see the graph added. The last data point is 7 days ago because we take a cumulative 7-day average. And so last week when we talked about the fact that we were bending the curve, it was because we'd had a couple weeks of this downward steady trend in cases in all but the Northwest, that green line. And so that's what we want to see. So now we know that the peak actually for all of New Mexico did really occur back in earlier in April. But we were monitoring the whole state, and now we turn to the red line. You can see that that actually has a steady uphill slope. We're getting more and more cases every day, a much higher percentage of cases every day. And so, and that affects the whole rest of the state as well, because as we all know, people travel over across county lines. I traveled across a county line to come here for this press conference. I'll travel across one on the way back home today. And so when we move, when we contact other people, that is how the spread occurs. But we believe that in general, and particularly for those of us who live in the areas represented by the green line, with extreme care, we may be able to safely begin to get out a little bit more, as the governor described. Now, if I might please have the next slide. This is directly from our modeling. We've talked a lot about ICU beds and ventilators. This is McKinley County. And as of this week, so let me just orient you to the graph. The blue line is the projected number of general medical beds we'll need. The orange line is the number of ICU beds we'll need. The red line is the number of ventilators we'll need in McKinley County if everything keeps going the way it's going right now. I only put one capacity line in, that's ICU beds. And as you can see, at least as of yesterday, all 14 ICU beds in McKinley County were full. And so we've begun a process through the centralized call center that's now up and running to transfer people. We've had approximately 40 people last week and approximately 30 people so far this week transferred from the northwest corner of the state to Albuquerque. And now in Albuquerque, all the major hospital ICUs are full to their normal capacity. And so they now are all busy shifting over to what we call surge capacity. In Albuquerque, due to the extensive preparation and really hard work of our folks at the university and Lovelace and Presbyterian, they have found a way to double ICU capacity in the state. And so they're in the process of doing that. But now ICU beds are indeed overfull. This slide is too complicated, and I have it in here for all the reporters who've been calling me asking questions about the details of the gating criteria. They are in here. I'm not going to spend a lot of time on this slide, but just to reiterate a couple things. We've had an economic recovery council that's been very active in the past week. The governor appointed them, and they have been emailing me examples of state, county, and city plans about every 15 minutes over the past week. I've read almost all of them, and working with our broad team, we've poured through them, and we're trying to pick the best things we can from every plan. The one thing that almost all the plans have in common is that they have gating criteria. Gating criteria say, these are the 4 things we have to do, or these are the things we have to do to open that gate, to just begin to think about and plan for reopening. And like a car, it doesn't work. You can't drive on 3 tires. You can't really drive on 2. If you've ever tried driving on 3 tires with one of them flat, you know what happens to that other wheel of the car. So all 4 of the criteria have to be in place. We have set some preliminary targets for these that we're going to use. They're based on evidence and in the modeling, the number of cases that would result from different levels. But you can see, we talked about the spread rate earlier, that we're aiming for 1.15. We think that's sustainable. Testing capacity, 3,000 a day. We believe if we keep doing what we're doing, with the unbelievable advances we've made, we'll be able to achieve that. Contact tracing and isolation capacity, quickly identifying people and their contacts and isolating them so they don't spread the virus, very important. We believe that we can achieve that as well within the timeframes that are here, but we may have to expand staff in order to do that. And lastly, the governor already talked about statewide healthcare system capacity, and that's critical as well. We can't, so you can see quite easily that if the whole hospital system is full, we can't reopen more things that will increase the spread of the disease. We have to go carefully, slowly, step by step. The main point, though, if I could go back, please, just to the previous slide. The main point, though, is all of our behavior affect every single one of these criteria. If we're not practicing social distancing, there will be more spread. That'll go up. We won't be able to progress in reopening. If we're sick and we're not going and getting tested, there'll be more spread, and that will drive the number of cases up. Contact tracing, if we're not cooperative as citizens with the calls from the public health department and thorough in our answers and very diligent about isolating ourselves, if we're positive, we need to, that will affect it. And of course, the hospital system, if we have more cases, we have more people in the hospital, more healthcare workers infected, and an overflow of the delivery system. So we're really the critical part every single citizen in doing this. Whether or not we're able to reopen more every time is really going to be almost completely dependent on the behavior of the people of New Mexico. Now, next slide is the mobility data, and I think we're still doing well. This is that Sunday, Monday, Tuesday, Wednesday, Thursday, Friday dots, where Saturday and Sunday are the lower parts of the curves and the weekdays are the higher. New Mexico's done a great job. We've brought mobility down by over a third. That helps. That's less people interacting with people, less spread of the disease. One thing that we need to be careful about, though, is that in February and March, the typical miles driven in the state is about 6.2 miles driven per person. But in April and May and June, that goes up. And so if this mobility continues to go up and more people are having contact, that will be an issue as well. I just wanted to say a couple more things about this. Just remember, the virus spreads from one person to another. I believe that social distancing in the COVID positive reopening world is going to be way harder than social distancing if you're confined to your home. I mean, at home, I have two other people there. If one of us gets the COVID, we'll probably all get it. We're a family. We eat dinner at the table together. But I'm not used to going out and making sure that I have my face mask in the car so that when I get out of my car, I can put it on. I'm not used to monitoring everyone to make sure I'm 6 feet away from them, although I know I am today in this press conference. I'm not used to thinking about configurations in the car or thinking about the fact that, gee, I can't really pick someone else up and drive them somewhere anymore. That's not part of my family. And so this is going to be a real challenge. And as the governor mentioned, as we slowly reopen, we're using the Johns Hopkins model that asks 3 questions. One is like, how many people are going to be there? I'm simplifying this. This is not what they said. How many people are going to be there? What's the intensity of that contact? Like, how long are you going to be with that person or people? And how close will you be with that person or those people? And then the third variable is, can we fix that at all? Could we spread people out? Could we only seat people in restaurants so they were 6 feet apart? Things like that. And so that's the methodology we're using. We have a graph that John Bingaman has made, and we have everything plotted out. And as we slowly progress, we're going to be thinking about those questions. And so somebody asked me, well, what about kids' day camp? Well, lots of people, lots of really close, intimate contact, and no possibility of keeping little kids 6 feet apart. So that'd be an example of something that would take a lot longer than curbside service with a business. So that's my little speech on social distancing and the fact that it's going to be harder than it is right now. We'll have a little more freedom, but this is going to be harder for everybody in the state. If I could have the next slide, we're almost done. Now, I don't want to spend a lot of time on this slide. It is available online. But what we did is we asked our modeling team to model what would happen in the top graph first if we just sent people back to school on May 1st. And this is a hospital sort of look, but it's the same. You could take that top curve and just substitute it for the number of cases, but we get an immediate spike. And then at the top of that spike, we'd have another press conference and we'd tell you we were closing everything down and everything would go back down. And then we would have, we would all get tired of that and we would try to reopen again. And if people didn't follow social distancing, we would have another spike and it would go back down. Now, I'm hoping you remember those 2 spikes there, because I showed you a slide a lot like that last week, and I'm going to show it again to you in a minute. What we're trying to do is a slow, gradual reopening, which we've also modeled on the bottom graph, where we slowly re-enter society. We slowly learn to balance the things we're used to doing, but doing them in a more safe way in a COVID positive world. And we keep those hospital resource needs and the number of cases and the number of deaths below our capacity. So those 2 slides sort of represent the extremes of what could happen, and the people in New Mexico are the ones who really are going to make that happen by being extra careful with social distancing. I think my last slide here is well, anyway, so I don't have that slide in there, but last week I showed you what happened in the pandemic of 1918 and the H1N1 pandemic in 2009, exactly those same double spike curves. We don't want that. I think the second most popular question I've been getting this past week is, what about antibody tests? It's all over the news. If you're like me, you need to set up a special email filter to just filter out all the advertisements and pleas to buy antibody tests. And the thing we all need to know is that almost all of them have not even been proven to be reliable yet. We don't have enough data to know that we should even be using them. There are 3 documents that are available online on the website under the MAT, Medical Advisory Team website, on antibody testing. There's the scientific paper that was written by the team. There's some guidance for physicians, and there's even one for the public. And so if you're interested in wondering whether you should get an antibody test or not, please read this. There's a lot of valuable information in here. Because of the rush to do testing, I think the FDA has relaxed its standards a little bit and let a few things through. But we plan on testing all of these in New Mexico and verifying that they're accurate before we have people take them. Because if you take an antibody test, so let me walk through this first and I'll be done. Blood antibody tests are very different than the viral swab tests that everyone's been getting. The swab tests tell if you're infected right now with COVID and you could be out infecting other people. And I'm making this a little simpler than it is, but I think this is generally 95% true. The blood antibody tests mainly don't tell you anything about whether you're infected right now. And in fact, if you are actively infected and spreading the virus right now, they're likely to be negative. They tell you if you'd have had a COVID infection in the past, so obviously in the last 3 or 4 months. The problem is with the newer antibody tests that are coming out that they can tell you that you have been infected when you haven't, or vice versa, and so you won't really know anything differently once you get the result, and there's nothing really different you do when you get the result. So we're still working on that. Everything I said will be different in another month or 2 when more research comes out. Be patient, and we will continue to provide information on that. We have identified 5 different manufacturers who run these tests in a laboratory setting, like you'd see in a hospital or a major reference lab. We have those in the state that are highly reliable, and we're just starting to introduce those, and our epidemiologists will be using those in the population of New Mexico to determine what the true infection rate is. So if you're like me and you don't want to have a COVID infection, please still stay at home. Go slow with the reopening. Be extra careful if you go out. Extra careful if you go out. Remember about the face covering. Remember about 6 feet distance. Remember about all those other 10 things we've told you about washing your hands and coughing into a Kleenex and throwing it away or into your elbow. Keeping surfaces clean. And by the way, if you're cleaning surfaces, make absolutely certain that those cleaning products are out of the reach of small kids. It's very important. And there was actually an uptick in cleansing product poisonings in kids in March. That was March, not April. But it's something to really watch out for as we're being more thorough and more industrious about keeping things clean. Let's be more thorough about keeping those products well out of the reach of small kids. And with that, I know that was a long report today, but I wanted to try to create some context and help you understand the major issues that we'll be facing as we learn how to live in a COVID-positive world. Thank you, Governor.
All right. Thank you, Dr. Scrace. I want to do a couple more slides before we take questions. So in this effort, I want to talk about some of the phases, and I also want to talk about what the practices of the different businesses then as we're expanding the retailers that can operate. So phase 1, we are hoping to mid-May look at all retailers, so not just the ones in the current order, which I went over earlier, could operate according to a retail COVID safe practice, and that looks at a 20% occupancy, and we use the fire code to determine how many people that is. That dine-in service at restaurants and bars could be permitted up to 50% occupancy, and can't have bar stool or standing services. And why is that? Well, we heard a little bit about the Johns Hopkins model that I referenced, which is you look at the duration of that contact as well as the number of individuals you contact, and we know that those are high contact, high duration activities. And gyms and salons and hotels and houses of worship, could operate also in a limited fashion according to COVID safe practices. And the reason I want people to see this is this effort we're making to provide information about how we're preparing, how we're looking at some of these phases, and an opportunity again to reiterate. It really depends on New Mexico. How well we do this means how safely we can introduce this. And we do want access to these services. And as importantly, if we do this productively, it means that we can save more of these businesses. I'd love to say in this press conference that if we do this, we can save all of them. The reality is we've lost some of our incredible New Mexico small business partners because of this public health global pandemic emergency. So we really have to be cautious about how we do that. And you see that we wrote it right on the slide. Your personal decisions will make or break the ability for New Mexico to both parallel our efforts for economic recovery and to support our local business partners in the state. I know that I'm going to do my part, and absolutely all of us are expecting you to do yours. Next slide. All right, so here are the COVID safe practices for every New Mexican. I just want to keep hitting this hard because we can do better. We do well. If we weren't doing well, we wouldn't be having a preparation phase. We wouldn't have an economic recovery council. We wouldn't be protecting our healthcare providers, but it's not perfect and we can always do better. And so let's talk about that one more time. Avoid unnecessary travel. Just because new businesses are open, it seems like it's a bit contradictory. Don't go gratuitously, but yes, as we're opening up, go to that curbside delivery, support a local retailer, support another local business. All right? Always, unequivocally, do not go anywhere when you are sick, except for medical emergencies. And I want to do everything we can to stop that confusion where people aren't seeking medical attention. Two things are happening. People who know they need it are afraid to go to a hospital because of COVID-19. That's a productive aspect about I got to be really careful. I don't want to introduce it to myself, but you cannot limit yourself to necessary medical services and emergencies. And the hospitals are prepared. This is not their first effort at dealing with infections. They know how to do this. They will keep you safe. We cannot have you not garnering and providing access to important medical emergencies. So don't feel like you can't do that. Of course you can, and you should. We're there for you. Wash your hands frequently. Everyone needs to keep doing that. We said it at every press conference. We haven't been saying it. Saying it again. This is incredibly powerful for limiting infection spread. This is our best control mechanism. Let's use it. Avoid touching your eyes, your nose, your mouth with unwashed hands. Frankly, if you can learn not to touch your face, I will say this is the biggest challenge for me, is not touching my face. It's allergy season. I'm compelled to do it, and I've really had to think about it. We can all do better. I can do better. All right, you need to clean and disinfect frequently touched objects, phones, surfaces. We do that every day. It's a practice I require by the staff that I have to come in to some contact with that we can't do over the telephone. They require it of me. You need to require it of your family and your coworkers. Only you can help us make sure that we're doing this effectively. Again, Dr. Grace, let's do everything in our power to keep that out of the hands of children. Now, watch for the symptoms of COVID-19 because with, cold season, with allergy season, people get confused and say, well, I have a cough, but not a fever. I have a fever, but not a cough. One of these, with the testing capacity that we have, we know that because there was no federal testing strategy, Today, there are still some states that without a doctor's referral or without all of these symptoms, you can't get tested. We have the opportunity to keep expanding our testing. It's not universal. I don't have 2 million viral test kits at my disposal in a week, and I don't have the capacity to even test 2 million. But we can do an incredible job, and frankly, not enough New Mexicans are getting tested. So come get tested. All right, we're going to keep expanding out to our high risk areas like grocery store workers, child care centers, nursing homes, and the like, all the essential workers, first responders. But we want you to also come to us. Any of these, fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat. And here's one that was talked about for a long time nationally, and I haven't heard about it much anymore. It's still a valid review. Have you lost your taste or smell? Do not go out if you have any of those things, all of those things, and let us test you. Do not, under any circumstances, go to work. If you must go out, these can mitigate. All right, we've talked about the difference between a respirator and the healthcare workers, making sure that they cannot pass that virus on to a patient, but this mitigates spread. Wear these. If you don't have access to a face covering, you make sure you call our non-health line. We'll help you get access. So many businesses are working and so many individuals across the state, just like my mask was made for me. And thank you, Santa Fe Opera. We think we can get you incredible access, and we've got inmates in corrections who are making masks. They made them for themselves. They're making them for as many people as we can. We will get you one. And it doesn't have to be this, just a multi-layered face covering in public makes a huge difference. 6-foot distancing. Do not be near anybody else. We can do that. Avoid gatherings. That means if you go to one of our state parks that we're opening and there are 50 people there, turn around. We'll find a way to make sure that you get access to a really great outdoor activity, but it gets too hard to do that 6-foot distancing. And do whatever you can to keep protecting vulnerable populations. Do everything you can. Do not connect with them. In fact, if you're a caregiver in your home, you have to do everything you can to limit where you're going. And if you need our help to support you with meals or any other essential services, please reach out and we will deliver food and services to you. That's the best way to safeguard the person you're caring for. Next slide. All right, here's what employers can do to help us. The more employers that can do this, the easier it is to go from that preparation phase into these next phases that we identified earlier in the slides and presentation. So for workers, limit your operations to remote work to the greatest extent possible. And we're going to keep doing that in government. We're hoping our local government partners will continue to follow suit. To the degree that private business can do this, I need you to keep doing it. If you can't, you need to arrange your workplace to provide for 6 feet distancing between the individuals who work there. You need to close common areas where personnel at the workplace are likely to congregate, break rooms, lunch rooms. We need to find a way for folks to get their lunches and their breaks at their desks or an area outside where you can do this distancing. And also remember, we don't want people to be around each other for long periods of time. That means an hour lunchtime. We need to figure that out. We need to provide for all meetings to take place remotely whenever possible. I see all over social media where people are having meetings, even local leaders in our state still, in violation of the public health orders, are coming together in groups of 10 or 20, and we will hold you accountable. These are not allowable, and if you don't provide for meetings to take place remotely, you are creating risk and you are transmitting COVID-19. All employees should be provided with appropriate face coverings and should wear them in the workplace. Now, I want to be really cautious about this. While we are seeing some general easing of access to medical PPE supplies, those supplies in large part need to be reserved to medical and first responder personnel and high-risk essential businesses like grocery stores, childcare workers. We need to be really careful about this. If you're a business and you've got access, many of them are telling me they do, to a surgical mask, fine. But do not work to try to interfere in making sure that every state, every healthcare worker, and every first responder gets the first line of PPE that they really need. That's why largely you see us in these do-it-yourself masks, because we're not providing direct healthcare or first responding services. And you got to train all of your employees on daily cleaning and disinfecting protocols, hygiene and respiratory etiquette. That means coughing in to your arm, and again, trying to have on these face coverings. Okay, next slide. You need to be prepared if you're an employer for making sure that hand washing and sanitizer and other hygiene support is readily available to employees. We continue to hear even for essential workers, that's becoming stressful as we open up. This absolutely has to be one of those required aspects. If you can, we are highly encouraging folks to screen employees before they enter the workplace each day, verbally or with written forms or apps, so that you're reminding employees to ask themselves, before I come to work, do I have any of these symptoms? Is it loss of smell or taste? Is it anything else? Because we know unequivocally that in some of our high-risk areas, some of the COVID-19 issues were brought in both by individuals who were sick and also individuals who might have been asymptomatic but maybe knew that they'd been exposed. So we've got to do a better job reminding employees that they have a responsibility before they enter the workplace to do everything they can to safeguard everybody else. Again, most importantly, you must prohibit employees. I sort of leaned in there, but if they have known close contact, they're living in a house with someone who's COVID-19 and they're still coming to work, this is problematic. The likelihood that they're shedding the virus is high. Everyone can't return to work without a 14-day self-isolation period. It's critical. Workers, employers need to ask these questions. Minimize non-essential travel by your employees. Adhere to all CDC guidelines and state orders regarding isolation. If you need to travel for work, you're 14 days when you come back in before you can return to work. I can tell you our bases are adhering to that, and I need everybody else to adhere to the same CDC guidelines. And again, just generally, anything I haven't talked about that's the CDC or OSHA guideline, I need employers to lean in and meet them all. This is how you keep New Mexico safe. Next slide. All right. This is the best practice for all employers. All right. And this is harder. All right. This is particularly for those employers that might have higher risk environments that we will look at later in our phases. If you can install large plexiglass sneeze guards at cash registers, this is incredibly meaningful. These are the best practices, and I want employers to see them. Look, that today's not a day, we're not mandating, but I want you to get a sense about what we know makes a difference. Okay, plexiglass sneeze guards, cash registers in particular. Arrange for contactless payment and receipt options to the greatest extent possible. I know some folks aren't going to use credit cards and use cash for payment. We can't do, we want to make sure that our consumers can access this. But if you can do this to a large extent, this will really mitigate transmission. Again, screen employees and customers, right, with a no contact thermometer if you can do that. Individuals with a temperature reading above 99.1, frankly, for all businesses should be denied entry. I don't know that every business can manage this aspect, but I want you to know what the best practices are. Those of you who can achieve this will be making a difference in New Mexico. And again, because not everyone has access, not everyone's going to ask state government to provide them or their local faith-based organization to make them and get them to them, offer face coverings and gloves to customers entering your place of business. Again, these best practices go a long way to safeguard the state and to lower transmission rates. All right, I think this may be up. Do your part. Okay. We're relaxing restrictions. We're trying to move safely, productively, prudently, and quickly. Quickly, open to interpretation, must be tied to evidence-based work modeling. But if you do your part, if consumers work to support businesses on these reopening standards and best practices, guidelines, then we can really do this. If the data shows that we are backsliding, then we have to take another course. Now, I would not just open up business or relax restrictions, and neither would the Recovery Council, just because another state is doing it, or because, frankly, we haven't even met the White House's, the president's 14-day declining case standards, right? There's a lot of different standards that you could apply. Flattening of the curve, protecting our healthcare workforce and surge, making sure we have enough healthcare services to meet New Mexico's needs. You know, that's what we said we would use. That's what we're using. But if that begins to shift, then we have to take another course. That course causes more economic damage than the prudent, steady course we're proposing today. All depends on New Mexicans. This again requires discipline. It isn't easier, now it's harder. And I just don't think that people, as I watch what's going on around the country, are hearing that message. They hear, we're open. They don't hear that you have a higher burden to bear because you're responsible in this social contract to mitigate spread. I know that you can do it. I know that we can do it. We're demonstrating it. I'm proud of the state. We're concerned about our Northwest region and our neighbors. We're going to continue to lean in to support them and help them through their higher transmission rates. And we believe we can also do incredible work there still to mitigate transmission and to save lives. I know this was a longer press conference when we have a huge new shift in where we are and where we're going. You should expect that to occur. I'm grateful that it gets this coverage and that people tune in and watch. It's really important. We're all in this together, New Mexico. Thank you. And we are ready, Nora, to take questions.
Thank you, Governor. First, we're going to go to
Okay, as we just heard from the governor, the stay-at-home order in New Mexico will continue at least through May 15th. That was already the date in place, as previously stated, but there are some modifications. These are some of those modifications. Again, state parks, golf courses, and gun shops can reopen with some modifications, but there are no changes to the following: restaurants and bars, mass gatherings, and if you travel out of state, you must stay at home and quarantine for 14 days. Again, there's much more to this. We, of course, will post this online as soon as we possibly can. But today, regarding the cases, 198 new ones of COVID-19 in New Mexico. We have now had more than 3,400 in our state. We also had what was believed to be the highest new number of deaths, 11. We are up to now 100.
Delivery service. The statute for liquor stores specifically prohibits that. So I can't create it. I think it's something that, given that this virus lives among us, we've got 9 months or longer before we have a vaccine. I think it is something that we really should consider, and I'm not opposed to that. But I want New Mexicans and our partners, our liquor stores, to know I don't have the power to give them that ability in the construct of the current statutory requirements. But I personally think that that would be the same as curbside pickup and delivery by other retailers and grocery stores and restaurants. And so I wish we could do that so it's clear to everyone about where you can go, how you can get it. Curbside pickup and delivery are safer than going into a grocery store. I'm clear about that, right? Person to person. I just don't have that authority under New Mexico's emergency powers. Next question.
Thank you, Governor. Next, we're going to go to Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go ahead and ask your question.
Thank you. Governor, you all seem to be taking masks seriously out in public. A fair number of people are not. I'm wondering if you're going to mandate them. And secondly, 8 days ago, you told us the state's capacity for testing was 5,000 to 6,000. It doesn't appear that we're testing to capacity. If not, why not?
Okay, so mandating and enforcing everyone to wear masks is incredibly challenging, and we take seriously enforcing. Our goal today is to get people to accept behaviors because they're willing to do it. There actually might be some individuals, right, on oxygen. That's a vulnerable population. I hate to see them out, but if they're living alone and driving and have to get to a medical appointment, requiring them to wear a face covering could actually interfere with good public health. So I don't think it's likely that this state, or frankly any state, will mandate that, but you should expect that we will push hard, and we're going to push employers hard, that they need to help us give this message out, and that they really ought to be asking and requiring their consumers to wear masks. Because what do they do when they do that? Not only are they protecting the state, they're protecting their employees. And their employees want these safeguards and protections in place. They don't want to bring COVID-19 home. They don't want to be exposed unnecessarily. So I really think that we can do that together, and that's the most effective way to change behaviors, is to get people to embrace them, and we'll keep role modeling. We are not testing to capacity, and you're correct. We did that 5,000, and now we're getting closer in the next, and tomorrow for sure, about 3,000, a little bit more. I will tell you that's because we aren't seeing as many folks come to us. Now, I actually might have to defer to Dr. Scrace. I don't know if somewhere in the life of the virus and in transmission, you sort of shift. Now we know unequivocally that you can have this virus and be asymptomatic. So when we said if you're a traveler, we said if you have any of the core symptoms early on, fever, cough, shortness of breath, we insisted that you come get tested, and people were desperate around the country and into Mexico to get tested. Everyone remembers the long lines at our drive-up testing centers. Well, now we don't have long lines. People aren't coming because they're not sick. So we then pushed out the testing to essential workers. We want to do more. It's a perfect question, Matt. We are encouraging New Mexicans to tell us. We'll tell you where. Check that website. Please, please come. We're going to do more messaging. Here's the hard, squishy part. If everybody tomorrow shows up at one of our open sites, we'll be overwhelmed. Some people won't be able to get a test. We only have those collection samples, up to that magic number. And we are pushing out, getting to every high-risk area, primarily nursing homes, but not exclusively. But we aren't seeing the kind of response we would like to see by New Mexicans. We have access, we want to do it, it gives us that surveillance. It also allows us to do better by asymptomatic individuals. So you're right, and it was a great place for me to say, please come get tested. And before I go to Dr. Scrace really quick, states are beginning to advertise all over the country. We're the first in the country to mandate testing for nursing homes, or we can do it universally, or we can, and again, this should not be a competition to do good public health work and to save lives, but we were really fortunate. We got in it early. We set up sites early. We had partners who stood them up with us early, and I was dogged about getting test kits. I still am. I spend some part of every day chasing what we call the consumables, right? The sampling on the one end, the swab and the medium, and the reagents on the other. But we can do more, and we would like to do more. And about whether or not we just are seeing more asymptomatic, I don't know if there's any evidence about that, Dr. Scrace, or not.
Yeah, just a couple things, Governor. You previously went through the newer symptoms just this week outlined by the CDC. And so when we were just focused on fever, cough, and shortness of breath, I think people were coming in for those. With the expansion, as further research is being done and more testing is being done, people without fever, cough, shortness of breath, but with chills or shaking chills or muscle pain or headaches or sore throat and loss of taste or smell, that there are more reasons now and more symptoms to prompt New Mexicans to get tested and providers to suggest testing to their patients. Further, as we do that asymptomatic testing, there's a lot in the medical literature this past week in particular as this proactive epidemiologic testing to vulnerable populations, nursing homes, homeless shelters, and even other groups like healthcare workers. particularly, we're finding a lot of people that are asymptomatic. And in homeless shelters, there are 3 studies this past week, up to 50% of people, both staff and patrons of the homeless shelters were positive. 80% were asymptomatic. Also, in the past 2 weeks, new evidence from China that when they really did careful contact tracing and found when each person contacted a COVID positive person that up to 44% of the transmission of the virus was actually from people who did not have any symptoms. And I think the last comment I have about mandatory face masks, there are many ways to do this, and I have my own personal plan, and that is I don't plan going anywhere or into any establishment where everyone isn't wearing a face covering. And I think if every New Mexican took that point of view, there would be a very rapid adoption across the whole state where it would just become the norm to do that. Because I'm wearing a face covering because I want to keep you safe. And you're wearing a face covering because you want to keep me safe. That's the social compact here, I think.
Fair enough. I also want Secretary Kunkel, who knows everything about testing.
Thank you, Governor, and thank you, Matt, for that question. I really appreciate the Governor explaining the core issue is that we were able to do significantly more testing when we had those established sites and we had huge volumes of people. It says shifting our strategy to going out to places requires me to have a larger team on the ground, and we're continuing to look at better strategies to do that. But it would be better if people came to the sites that are still open, still there for you. We will test you. You don't have to have the old criteria. So I would just want to reiterate that. We can test more. We want to test more. Please come out to us. Thank you.
And I know we need to take another question, but Matt, it's a very interesting dichotomy here. Again, we do not have 2 million tests. I wish, frankly, we did. And all of the scientific evidence would suggest that's too many people to be testing. So fair enough. But where most of the world, and certainly most of the country, is still really exacerbated by not having access to tests and just now announcing what I would sort of refer to as a expanded, or what they're calling more universal aspects of trying to test in certain areas, surveillance. We've been doing, and now we have more, we've got more samples that we could collect than we can get done because people aren't coming to us. So we want to close that gap. You helped us get that message across by asking that question, so thank you.
Thank you, Governor and Secretaries. Next, we're going to Julia Goldberg with the Santa Fe Reporter. Julia, you are unmuted. Go ahead and ask your question.
Thank you very much. I had a question, 2 unrelated questions. I noticed in the modeling that the state is looking at 20 days out what the impact might be on New Mexico from border states, Texas and Arizona, and possible policies to address that. I was wondering what the thoughts were, what kind of policies. And secondly, just wondering if this news about remdesivir would come into play with any of the preparations, if it would maybe change how the state is thinking about life in COVID prior to a vaccine. I think that's it. Thank you.
Okay, I didn't really hear the last part of the question, the news about...
Antiviral.
Oh, the antiviral? Okay. I'm gonna go to Dr. Scrase. I'm gonna do the antiviral just quickly. Look, we know that we have incredible expertise in the state. I'd like to thank every New Mexican who thanks me, and also tell the New Mexicans who are concerned about our policies and positions, who respectfully tell me and give me other strategies. I expect both and appreciate that kind of respectful discourse. It's powerful and it helps us stay balanced and informed. But there is value, which I don't think that Dr. Scrase intended not to do. I'm gonna torture him a bit. We want antibody tests and we want to do that surveillance. There's a lot of scientific evidence, even using that to think about the vaccine, using some of those strategies and aspects, and trying to figure out immunity. So, if we tested one person several times over a course and they didn't get COVID again, that gives us information. What we want to be careful about is that there's no evidence today that suggests that doing antibody testing gives us the information to slow the spread of the transmission of COVID-19. And that we can't stop doing. So we are going to engage in both. And in fact, that when he talked about we've identified the right products, the right strategies, and that the medical advisory team will keep doing that. As you know, it's already happening in New Mexico in a couple of hospital settings. It will expand, and we've gotten commitments for antibody tests and kits coming to New Mexico. The first validation of some of those, because for me, it was a hard thing to learn, and I hope New Mexicans will forgive me before I go to the expert. And he is, in fact, the expert. There are all kinds of laboratory instruments that run all kinds of blood tests and viral tests every day. We do that all day, need to still check for flu and any number of other infections. But when you have a new test, right, so we can pull out COVID-19, and then we're looking for COVID-19 antibodies. That requires a way to take your laboratory instruments, validate that they can actually do that with these new kits. And then you have to have an FDA approved, right? Once you validate it, and it takes software and a run, then you can do it for the general public. And so I made it sound incredibly easy for these laboratory leaders. It is incredibly complicated. So complicated that many universities and labs around the country actually couldn't do it. New Mexico had several labs, several experts, and a shout out to all of our molecular biologists who can actually really effectively do this work. So we've been kind of a place where when I make the case to get those, they know we have the capacity to do it. So May 1st, tomorrow, I know that we've got a laboratory that will have access to that testing phase for antibodies, and then we will get material in the next 5 to 14 days so that we can expand what we're doing. I'm not going to make those decisions about where, how, and how we use that evidence without the medical advisory team and our medical experts, and that's Dr. Scrace. Do you want to elaborate?
Yeah, I can say a couple things about both questions. Thanks to the initiative of a friend of mine and a great colleague, Christoph Lambert at the University of New Mexico. Those of us on the MAT leadership team get a summary every night of, approximately 50 to 100 things that have come out that day in the medical literature or in the news, or it's a wide variety, on a wide variety of topics. And so there's a therapeutics section of that. We have a therapeutics section of the medical advisory team, which has now grown to 150 different physicians and PhDs and other kind of providers, constantly looking at what's new and figuring out what's important. One thing is that if you click on those links for each article, almost every single article has a very large warning at the top of it that says, this has not been subject to the peer review process. Normally, all articles are subject, and research is subject to a very intense peer review process. I've been through it, it's hard. And so what's happening is, in the rush to get information out, these things are being published. So the MAT therapeutics team, with respect to all the antivirals, not just remdesivir, they are looking at each one. They're reviewing. Usually it takes a couple, 3, 4 articles to give us a sense that it's working. A great example was hydroxychloroquine, where there was a big push for that. And 1 or 2 articles, one from France, looked promising. And then somebody took the time to combine all the little tiny studies together with all those numbers into one big one. And now the scientific opinion is, well, maybe. So we backed off our recommendation from using it to consider using it, understanding that the data isn't available. And all those papers are on the DOH website under MAT. The last thing is about 20-day modeling and border spread. So somebody's already gotten on the website and looked up at the slide presentation. So thank you for doing it and raising the question, because it brings up a really important topic that I was hoping someone would ask about, and that is, hey, other states are opening up. We can just drive from Las Cruces to El Paso, go to a restaurant, go bowling, catch a movie, and come back. And my specific medical advice to anybody who's thinking about that is do not do that. You're just going to go substantially increase your risk of getting COVID and substantially increase the risk to other people you come in contact with after that. And so we don't have the ability that we're not blocking off the borders, but traveling, interacting with other people is what spreads the disease. And we're already seeing in other countries that people who have opened up like this are now backpedaling and having to close down again and finding out that they had a big uptick in cases like the curves I've showed you last week and this week. Number one, and two, it's only going to be a matter of time. We know that as people congregate more, there'll be more cases. There'll be more hospitalizations, there'll be more people on ventilators, and there'll be more fatalities. And so that's not an experiment, that is the behavior of the virus. So I think we're just calling on New Mexicans again to use good judgment. If you live near a border where things are more open than they are on the New Mexico side of the border, think of your people in your family, think of the people you meet every day, and stay safe. Thank you.
And the last thing, support New Mexico. This is painful that we have such grave economic losses and impacts. Incredibly painful. I'll bet there's not a one of us who isn't personally concerned about economic security, and then quite frankly, really concerned about our neighbors and friends who've lost their businesses and their jobs. We are at a critical phase in this country. Right? All the national reports are showing that with the increases to unemployment, we're at Depression era levels. So this is an incredibly serious issue that must be addressed, and it doesn't have to be addressed at the expense of public health and safety. They impact one another. We're clear about that. We're going to do this in a safe way. But when we don't stand together, all together in New Mexico, and support New Mexico businesses who have supported us. There are many, 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 many businesses who have restricted, who did what we call metering, few people in at a time, well before there was a public health order declaring that they had to do that. They just did it, or introduced protective covering, face coverings and gloves for their employees. We've done a really effective job. We can do better, but when we start crossing borders, and it's one of the reasons these regional plans have been so tough on states, and I'm participating, but they're trying to figure out, right? So Arizona opened, but they're really struggling with some areas and some counties in Arizona. Same thing with Utah, and they're doing a slower approach. Same thing in Colorado. They have certain regions and counties that they're really struggling with and not struggling with, but they're not sure. Same with Texas, who's seen an uptick in cases in the Dallas and Houston area. So and in another week or so, we're going to see some impact on the country, which will impact all the other states. So we're all trying to manage the information and to do it as safely as possible, because not having an economic effort and investment in a safe way is not sustainable until we get a vaccine. Everyone in the United States, I believe, is clear about that. This governor is clear about that. And so we're hoping that your participation helps us, right, to maintain these efforts in a progressive, productive manner, and I believe that we can. So we appreciate these questions.
Thank you, Governor. Next, we're going to go to Brandon Evans with KOAT. Brandon, you are unmuted. Go ahead and ask your question.
Good afternoon, everyone. So two things. First, does the easing of the restrictions this phase change anything with what constitutes mass gatherings and the amount of people that can legally hang out at the same place? That's the first question. The second question involves nursing homes, specifically looking at two of them. One of them, the Genesis one in Uptown, has the highest COVID rates in assisted living. And then the other one, been a lot of deaths at the one in care center in Farmington. So what is the state doing about that?
So the new order continues to mandate that no mass gatherings, so no more than 5 people in any one place. We recognize that we have a different metering component for occupancy when we're going to our essential businesses. So all that stays the same. The mass gatherings is the toughest because people stay together for long periods of time and they're in close contact. That's why that's problematic. But if you looked at how I identified some of the other work from a preparation phase to phase 1, phase 2, phase 3, as we're looking at that, that's going to be the most difficult aspect to determine safe, practical, prudent practices until you have a vaccine. Because when people are in close contact, so a concert, that's when it gets really hard to manage or mitigate transmission. So the mass gatherings order is exactly the same as it was. And I know that that is tough, particularly for, family events, funerals, and weddings. And I am sensitive to that fact. I have a family that would like to engage in those respectful celebrations of life and those just incredible celebrations that we can't. And so that's tough, but I know that it's too early to do that. And given how we've analyzed using the Johns Hopkins as a source for productive, evidence-based, look at these things, the number of people, how close in contact, and how long they're in contact. Mass gatherings is the toughest thing for us to figure out how we safely do. Nursing homes. Nursing homes are an incredible challenge in New Mexico and around the country. And it is an area that I find incredibly disturbing because it's all vulnerable populations. And it is one of the reasons that we are going in, and they are too now. They're getting their own test kits and deploying them. So we've got 71 facilities. We want all of them to recover who currently have COVID-19, and we want the ones who are COVID-19 free to stay COVID-19 free. The facilities that have widespread COVID-19 infection rates are incredibly challenging. A team goes in, led by the Department of Health and other experts. They have to immediately follow state criteria for infection control, and they do that. If they don't do that, they're accountable. It's a really tough set of circumstances. And I know that I'm probably harping, but we need these caregivers. I mean, they are champions. They're incredible. And they're asymptomatic. They have no idea. So we get tests, and I think that if we'd had 100 point of care tests, if I had been responsible in the federal government for testing, I would have provided rapid point of care tests to nursing homes and hospitals, and I would have deployed them all over the country, because then you could test people as they were coming in and ask people to come in an hour before a shift change, test them all, and it would take a little bit longer to go home, test them all, and we could have done that. And would it have prevented every case? Probably not, but it would have prevented a great deal of them all across the country. And I hope it's a lesson this country learns. We have the expertise to do that. Just to give you an example, there are 2 different kinds of products that were deployed by the federal government to states like this one, like New Mexico, us included. Abbott's and Cepheid that are rapid, what they call point of care. It means that you can run a test, takes about 45 minutes. It's one at a time. We do have an instrument in New Mexico that could run, several at a time, but they didn't give us the right commodities or supplies to do that. So this is why governors are so upset about the testing strategy. So we're going to go out. It's a partnership. We're doing the surveillance. It's incredibly aggressive by the Secretary of Health and our entire team. All the nursing homes and family members should expect us to get to all 71. A great majority of our testing now is directed at nursing homes. The nursing homes, the Life Care in Farmington and Uptown Genesis are high-risk areas. We're well aware we're in. And it's painful, but they are required now to go to their direct infection control. Even for one, they're required to do that. We actually have, to your question, we have 6 facilities that have 10 cases or more. These are our highest risk cases. They get what the secretary referred to as kind of the SWAT team interventions. And we've got 27, I think, facilities with 1 case to 10 cases, and we're paying close attention to them, but it is a high-risk area for sure. The best thing I can say is we're devastated and don't want any more transmission in any more long-term care facilities or healthcare facilities, which again gets right back to the social contract with New Mexicans to the highest degree that we can. Secretary, have I missed anything about that?
Only, I would say, in addition to, thank you, Governor, for everything that you did say about that, the testing team run by a public health physician, Dr. Sanzoni, many of you have met her. She's been everywhere in the state. This was an area of focus for us right from the start. So it was a very sad, very troubling development for us. I can tell you that the Division of Health Improvement, who's responsible for surveying and licensing long-term care facilities, long before there was COVID in New Mexico, reviewed every single nursing home's infection control protocols with the CMS Titan security. Even today, they assign surveyors to every single nursing home, and they do daily calls and video reviews of their infection protocols. We encouraged, and did not mandate, but I believe we encouraged 15% surveillance of every nursing home a week or two ago. Even with all of our precautions, when an asymptomatic person comes encounters with this very vulnerable group, it's almost impossible to stop. And so we mourn that and continue. So we do have aggressive interventions. We go in, the testing team, physician, nurses, and experts from the public health department go in and evaluate their ability to isolate, attempt to get isolated wards and review again infection control, do everything they can to improve the situation, but it is extremely difficult to arrest. So our other intervention is to get in quickly when there's one positive and try to keep it at that. And I think, Dr. Scrays, you have something?
Yeah, I just wanted to add, I think the aggressive testing is going to help us here in New Mexico, but just to give a broader context for everyone listening, this is a worldwide problem. And the majority, greater than 50% of COVID deaths in Europe occurred in people living in nursing facilities. And I think the governor pointed out this is a very, very vulnerable population. And now that we're understanding better that we did not, the science didn't know 8 weeks ago how prevalent asymptomatic spread can be, it's very difficult to, I mean, you could literally test every worker and every resident every hour.
That's right.
And, you know, you wouldn't know where to stop that surveillance. But I feel like the aggressive approach Secretary Kunkel has taken and her team, they really are out there. I hear reports every day about multiple numbers of nursing homes being completely screened and tested.
Right. And I know that you didn't ask this, but every single death is a tragedy, and which is why a vaccine is crucial. And every state needs to do their part to make sure that the evidence and scientific work is aggressive but safe in getting a vaccine out. But as a caregiver, it's incredibly painful when there are statements both in this state and out of the state that this is a population that's vulnerable anyway, that dies from the flu, that dies from falls or swallowing disorders, and they're all in their 90s. These are human beings that are our brothers and sisters and our mothers and fathers and our grandfathers and grandmothers. These are valuable members of our community who depend on us for their care and support. They are incredible, tragic losses, and it is an outrage that anyone, anywhere in the country or in this state, would cavalierly suggest that our resources should not be placed there and that our restrictions and social contracts should be avoided because that's a population we can't really manage. And I think your question was, are you doing everything? We think we are. Can we do more? We are working to do more. Are we outraged that every time we lose someone because of this vicious virus? We are. And I just compelled to say that. Every single one of those individuals is a loved, beloved family member who deserves our attention and our support. And we're going to do everything we can as a state. And we believe that we can still do more even in these 6 facilities that have more than 10 cases and are very high risk. We'll just keep doing more, and we'll require the experts, that's my job, to get every bit of evidence-based strategic efforts underway. And quite frankly, it's why we have a Navajo Nation rapid response team. Like, we can do more, we must do more. There's got to be other strategies that really do reduce the rate of transmission and save lives. I just can't believe otherwise. So we'll keep fighting for every single New Mexican. And I appreciate you raising that question. And it is a very painful effort and a very painful reality of what this virus can do to a community.
Thank you, Governor and Secretaries. Next, we will go to Dan Boyd with the Albuquerque Journal. Dan, you are unmuted. Go ahead and ask your question.
Yeah, thank you. Good afternoon, Governor, Cabinet Secretaries. You've mentioned the high infection rates in McKinley and San Juan counties in the northwest part of the state. As part of the approach to dealing that, are you considering additional isolation and quarantine orders and perhaps other types of drastic action in the Gallup area?
In fact, Dan, we are. Now, the way to make that most effective is to be working with all of the partners. So every sovereign nation in the northwest corridor of the state, those counties, those 3 counties in particular, San Juan, McKinley, and Cibola. We are getting requests, and I don't know the full extent right this minute, but we'll get right back to you when we do. It seems to me that those localities are looking at ways for us to be more assertive in restricting access into those communities and not relaxing restrictions, but actually doing the opposite of that, recognizing that they need to save more lives and we need to be working together in a concentrated effort. And it really speaks to that whole preparedness, preparation phase. You know, we've got areas of the state that just aren't ready to be relaxing and need more support by the entire state, which is why we transport patients, why we have a statewide medical advisory team. We didn't make it, you know, so that you have one physician or one person who just works on it for a city or a county. But New Mexicans should expect that the relaxing of restrictions will not apply to the northwest region of the state. You should expect that order to be very clear about that, and you should expect that there will be broader restrictions in some communities in a full partnership with those communities, and those details are being worked out right now, and they would be effective tomorrow. Yes, Dr. Scrace.
2 other quick comments, Governor. Number 1, yesterday, I believe it was, or the day before, physicians, intensivists from Albuquerque reached out in a teleconference with the folks in Gallup to try to find ways to support them. They're really running at over full volume, and they agreed to start transferring more patients into Albuquerque to give them some breathing room there. And then the other thing I wanted to mention is just to remind us all that any intervention we make, no matter what it is we do, it takes 8 to 10 to 14 days to see a difference, because remember, there are already people who during this press conference have infected others. They're going to take 3 to 5 days to have symptoms. They may spread that to other people before that period. And so it really isn't. It would be like trying to adjust the temperature of your shower when there was a 2-minute delay between when you turned the knob and the change in the temperature of the water. And so there's a long lead time on these things, and that's why the modeling is so important also, to try to do the best we can to look out ahead and see what we expect based on all New Mexico data. So I just wanted to add those 2 things, because those will come into play in the coming weeks in the northwest part of the state.
Thank you, Governor and Secretaries. Next, we're going to go to Chris McKee with KRQE. Chris, you are unmuted. Go ahead and ask your question.
Thank you very much. I wanted to ask a question to that question about the Northwest region. We understand that the mayor of the city of Gallup wrote a letter to the governor's office today. It's posted on Gallup's website, gallupnm.gov right now, requesting that the governor's office declare a, quote, state of emergency pursuant within the boundaries of the city of Gallup. They're saying that the virus has caused many deaths, stretched medical facilities and resources to their capacity, and impacted the welfare of the city of Gallup. And the letter goes on, but simply put, I wanted to ask, will you declare a state of emergency in Gallup, and what more specifically is going to happen there? Because clearly the numbers are continuing to go up there?
Right. Well, I referenced that there was actions being taken by local leaders in McKinley County, specifically the city of Gallup. There is a potential for more of those requests and declarations, so I'm waiting for those, that potential. But absolutely, this is a partnership to save lives. It is something that I want to thank the leadership. These are hard decisions to make for your community. I think it takes incredible leadership, and we want to support that. Finding the tool to do that effectively and really thinking about ways to collapse our services and supports so that we're limiting access and transmission into Gallup is being worked out, as I referenced earlier. You should expect Chris to get more information about that shortly. I just want to make sure that as we identify the vehicle, the legal vehicle, and we're clear about all of the supports that we will take from the state, which we will provide, and that it will be in effect, I believe, tomorrow. So kind of a long answer, but yes, we accept that declaration. We'll respond with an enactment, and I'm just waiting for a couple more details from other community leaders who are trying to get their arms around this, and I want to make sure that they have our full support. To say that publicly, they have our full support.
Thank you, Governor. Next, we're going to go to Jeff Proctor with New Mexico In Depth. Jeff, you are unmuted. Go right ahead.
Thanks, Nora. This question is for the governor. We have seen reports from all over the nation, Ohio, Louisiana, Illinois, New York, and more, that when wide-scale COVID-19 testing is performed in jails and prisons, significant portions of those incarcerated populations and the guards who supervise them have the virus. As of today, here in New Mexico, 8 inmates and 33 staff members have been tested, with 1 staffer testing positive. For context, there are nearly 6,600 inmates in the state's prisons with about 1,800 staff. My question is in 2 parts. Why hasn't more testing been performed on inmates and staff in the prisons? And part 2, as you are ramping up sentinel and surveillance testing around the state, do you intend to include the prisons in those efforts? If not, why not? Thank you.
Yeah, thank you for the question. Again, high-risk area, we're clear and appreciate the question. Our efforts have just started in the surveillance aspect, and given the issues with nursing homes, jails, first responders, and hospitals, we haven't been as robust in getting to all of the correction sites. But in fact, you might remember that we are part of a pilot, and we've been negotiating with the White House about exactly still, believe it or not, what that means, but I can give you this specificity. They've now said, tell us how much surveillance you have the capacity to do. There was some dancing around that with the 9 states. We are providing that. Some CDC personnel tied to the pilot are already on the ground in New Mexico, already working on the contact tracing, already implementing some of the recommendations for those digitized or software strategies, already identifying, because it's a lot of personnel for really effective contact tracing. It's like 670 people doing just that work in a very cohesive manner. And being trained to do that. So that's already happening, because I'm surprised I haven't been asked about what the progress is. But the next thing that will be delivered, and my goal is mid tomorrow, that was a hint to the folks who are working on finishing up that proposal, there will be leads in the state for surveillance testing. Corrections is one of those lead areas so that we can get to all of them. We agree. Any of these high-risk areas must be part of serious surveillance and testing, and we're on it. I wish that aspect by the federal government and the CDC had materialized a bit faster. You can see that we rolled out the healthcare workers and the nursing homes. We did not go to any corrections facilities, looked at risk areas and symptomatic personnel. But yes, in our plan, should be in the plan, should be part of your high-risk strategy, should be part of your surveillance. We did the same thing that we did also to other high risk. They had to do all the mitigation strategies. Temperatures in, right before you come to work. You have to have face coverings, gloves, infection control strategies. Inmates must have masks. They made them. That happened in phases because we were making them. But we really tried to employ every single strategy we want available everywhere else. We also know that in federal corrections facilities, detention centers, there have also been positive COVID-19 cases. And, you know, I have certainly made it clear that they should be utilizing the same standards that the state is requiring and have made that clear. I can't say today that it's meeting our satisfaction.
Expected to roll Friday and